Hey, this is Harnett with a one-take Work.Love.Play daily video blog. And you can see, I don't know if you can see that I'm by the little Christmas tree by our bridge here in town that's maintained by the volunteers. And that's not what I'm here to talk to you about. I am here to talk to you about a concept I would like to continue. I haven't done really much on it on the video blog, but I've written a lot about it. I tweet a lot about it, and I've had a lot of passion about it a long time. And that's, how do you know the truth? How do you sift through all this quote-unquote research that's released, it seems almost every day in the media, and know what's right? And while I've thought about this and written about it and talked about it a lot, I really have decided to try to concentrate some efforts around this for a couple reasons. I chose today because today the Institutes of Medicine released their revised guidelines on vitamin D. And for people who do follow the medical research in the media, so not in the literature, you've seen a lot about vitamin D, low vitamin D levels, which is also called the sunshine vitamin, related to everything from cancer to depression to specifically breast cancer, in addition to some of the cancers, osteoporosis, and so on. And people who are really big proponents of larger vitamin D intake also being added that can only be taken by supplementation, looking at least 1,000 to 2,000 international units, and in some cases with people who are diagnosed to have low vitamin D levels, sometimes 5,000 international units a day. They, I'm sure, are disappointed with the results that came out today, which essentially raised the daily limit a little bit, or the daily recommended dosage a little bit. One take, remember, one take video blog. But they're going to be very disappointed because you're basically looking at about 400 international units, and with people over 70, potentially 700 international units. And they last year upped the dosage for children. Why did that happen? Well, it happened because looking at all of the research that is considered to be statistically significant, random designs, well-done studies, that's all the research called for. That doesn't mean that some of the early research out there will not eventually change this recommendation, but it does mean that right now the propensity of the data, or the largeness of the data, and the statistical significance of the data does not warrant the recommendations that a lot of us are following. I personally have upgraded my intake of a supplement with vitamin D. I won't tell you what dosage. It's relatively low compared to what some people are doing, and that's for a number of reasons, because I'm really fair-skinned, but I use sunblock every day, even though I'm outdoors quite a bit. What I could do instead of doing that is I could go outside and do 10 to 15 minutes of unprotected sunshine, and I'd get a very similar result. And that's the best way to really attack this. But by the way, I'm not here to give you medical advice per se. But what I am here to say to you is, how do you figure out the truth? And I'm going to start to try to address that, particularly around health and wellness topics. I will tell you there's a group of scientists who are now, who are not affiliated with pharmaceutical companies or anything like that, who are now reviewing the media coverage of the literature and grading it. And I will start to tweet that information, put it on LinkedIn, put it on Facebook when that's appropriate, although I try to use it only for personal reasons. And at least from my end, try to get that message out. I'd ask all of my colleagues to start to do the same thing. Let's be really careful about what we tweet and retweet. Let's make sure if we do tweet something that we also know where there's limitations, so people really don't get mixed messages. The breast cancer guidelines were a real key on how really good guidelines were misinterpreted by the media and emotionally responded to by the public. So to bring this all together, because I feel like I might have been a little all over the place on this one take, what we have to figure out is, how do you know the truth? And how we know the truth is by sifting through what we concretely know, because we have what in the sciences are called the preponderance of the evidence. But it just means we got a lot of information that we know for sure, or as best we can, that this can be true. And let's help people sift out and know when we talk about something whether it's still experimental and we don't really know. So this is Carol Harnett with a one-take Work.Love.Play daily video blog, hoping you're having a great work day, that you will get to enjoy some love today, and don't forget to play. Thank you.